Hey, hello everybody. My name is Dr. Martin, and today we're listening to Diva Patel. Diva is our afternoon co-op technician at the office. We're exceedingly proud of her. And her presentation this week is going to be about glaucoma. So, Diva, we would love to hear what you have to say about glaucoma. Here we go.
Alrighty, so what is glaucoma? Glaucoma is a complex disease that is caused by an increase in pressure in your eye. What increases the pressure in your eye is a buildup of fluid. The pressure that is in your eye is called intraocular pressure, so that's what increases, and it causes damage to the optic nerve. So there are three primary types of glaucoma. There is primary open-angle glaucoma, or POAG. It's a slow and painless progression of glaucoma, and there's usually not any noticeable vision loss, but by the time it does begin to occur, the disease has progressed pretty far. There's also normal tension glaucoma, which is another form of open-angle glaucoma. However, the pressures are in with the normal levels, you just start to lose your vision. The cause of it is yet to be identified. Angle closure glaucoma is a sudden increase in pressure due to a blockage in the drain canals of the eye. This type of glaucoma develops very quickly and is considered a medical emergency. So here is a picture, and there is the optic nerve. So the pressure builds up around here, and it kind of pushes this way, and the fluid builds up around this area and causes damage to the optic nerve right there. So symptoms of glaucoma: for primary open-angle glaucoma, there are blind spots in your peripheral vision, and there's also tunnel vision in the advanced stages. For angle closure glaucoma, there is ocular pain, severe headaches, nausea, vomiting, blurred vision, halos, and redness. This type of glaucoma, like I said before, is a medical emergency, so you should probably go to the ER and get it treated immediately. And then this is an example of what your vision would look like with glaucoma, so you can see the tunneling effect. But it's different for everybody, so you can never be certain what your vision will actually look like if you have glaucoma. Treatment: the damage that's already done with glaucoma is irreversible, but vision loss can be prevented. One way to prevent it is eye drops, which will help improve how the fluid is being drained from your eyes, or it will decrease the amount of fluid being produced. Oral medications are used when eye drops do not help lower the intraocular pressure. There's also laser therapy used for primary open-angle glaucoma, where a small laser beam is used to open clogged channels in the trabecular meshwork. There is filtering surgery, which is an opening in the sclera, which is the white part of your eyes, and the trabecular meshwork is removed. Drainage tubes is when a shunt is placed in the eye to drain excess fluid, and minimally invasive glaucoma surgery, or MIGS, helps lower intraocular pressure, and depending on where your glaucoma is at, your eye doctor will suggest a certain type of the surgery. There's also testing that can be done for glaucoma. There's tonometry, which is the measurement of the intraocular pressure in your eyes. There's also eye dilation combined with imaging. OCT imaging is a picture taken of the optic nerve. Pachymetry is a measurement of the corneal thickness, and a gonioscopy is inspecting the drainage angle. There are also visual field tests, which check areas for vision loss. This is an example of the cornea pachymetry, and these numbers indicate the levels of pressure in your eyes. And due to primary open-angle glaucoma having very few warning signs, it is important for you to visit your optometrist for regular eye exams. And then here is a picture of what the imaging would look like. So here you can see a normal optic nerve head, and then here you can see optic nerve with glaucoma, and you can see a little bit of cupping right there and right there. Risk factors: one of them would be being over the age of 40, even having a family history of glaucoma, or any medical conditions such as diabetes or high blood pressure. If you have thin corneas in the center, thinning of the optic nerve, extreme nearsightedness or farsightedness, eye injuries. If you are of African, Hispanic, or Asian descent, you have a higher chance of having glaucoma, and also a use of long-term steroid medications. So some facts and stats for you. Glaucoma is the second leading cause of blindness in the world. There is no known cure for glaucoma, and everyone is at risk. About 3 million Americans have glaucoma, but only half of them are aware of this fact. In the United States, about 120,000 are blind from glaucoma, And estimates put the total number of suspected cases of glaucoma at over 60 million worldwide, and glaucoma accounts for over 10 million visits to physicians each year. And there we have it.
Outstanding. One small correction, and that is that pachymetry is actually a measurement of corneal thickness. So corneal thickness factors into the pressure measurement. The thickness of the cornea can change what the actual measurement is on the cornea. I just wanted to take a moment to reiterate that to make sure we had all of the information correct. Diva, you did an amazing job today, and we're super proud of you. Everyone, Diva Patel, birthday girl. Be sure and click on her thing today and wish her happy birthday.